And we appreciate being able to come tonight because we're actually in some phases of actually looking at changing some of our processes. So it's perfect timing to get some feedback on how you would like to provide us with information when you call for appointments, either for yourself, your children, someone else in your family. So one of the things we would like to know is tell us a little bit about how you feel when you're on the phone making appointments and we need to go through the term decision trees for us is when you call for an appointment or a symptom or a medical condition, there are questions our physicians may want us to ask to drill down a little bit more so that we can make sure that we're getting you with the right provider so that when you come here, you're seeing the physician that you really need to see medically. So we need to take some time to ask those questions, but then we also want to make sure that we're getting some insurance information so that we can make sure that we provide you with any information should your insurance not be compatible with Mayo, talk a little bit about what your out-of-pocket may be, et cetera. So we really would like to know how you feel and give us feedback about that process as we go through asking those questions. We really would like to know how you feel about us going through the whole conversation. Sometimes those conversations can take 10 or 15 minutes depending on how lengthy the medical questions may be. And would you rather do it on the phone? Would you rather have us call you back? Would you have your insurance cards ready at that time? How prepared might you be? So we're really trying to get input so that we can make sure that we're taking care of our patients, booking the appointments in a timely manner, but also making sure that we're getting the insurance information we need and that you need so that you're not faced with surprises when you come here with out-of-pocket expense. So I'd really be just open for feedback on the process because right now we do it in a variety of ways and we would like to help improve that process. Yes, sir.
I have a lot of difficulty with the appointments process, but I would just say that very often if you call like somebody and they get back to you, they may get back to you, but if you're not home and you get a message and you try to reach them again and they're on the phone with other people, it's very, very hard to get the same appointments person back twice. And so I would definitely not do this procedure where you're playing phone tag for a week because I don't really think that works unless you give someone a dedicated number for a specific person and you can get through it. The other thing I wouldn't do is a lot of times people in the appointments office they'll say they'll give you an appointment, then they give you an appointment, but they don't tell you they gave you the appointment. So sometimes you look at your itinerary and you'll see, and this has happened to me 3 times in the last 2 months, and I know some other people have happened to too. Well, all of a sudden you look on your schedule and you have appointments there you didn't know anything about. I mean, you knew you were thinking that you were going to be scheduled, but you didn't know you were.
Okay.
And they don't ask you like what is it convenient for you. So then you look at it and it looks like it's inconvenient. Then you have to try to reschedule it, and that can be a real problem.
So getting in touch with patients.
So I think it's important to try to sort of give the appointments, you sort of negotiate the time and and the situation with the patient, and not just do it for them. But I just think that leads to all kinds of issues.
A lot of rework, a lot of inconvenience. That's good
Well, for the
feedback.
doctor too, because some of the doctors could be preparing for you, and then all of a sudden you switch to another doctor because of the appointment inconvenience time. And then I just think there's a lot of issues with that.
So any thoughts? And that's great feedback once you get the appointments. But any thoughts about when you initially call, and you may now try to remember back when you were a newer patient, or if your insurance changed, what you think about that?
Don't say things like, which I've heard experienced twice. Yes, you don't have an appointment for 3 months, but do you realize how busy the doctor is? Because that's the worst thing you want to hear, because you want to feel that you're important too.
Absolutely.
And I've heard it from and again, I get this a lot from the appointments people.
Okay.
And I just think, frankly, I try to make appointments through the front desks, because I just find the appointments just to be
Process easier.
in terms of getting it.
That's good feedback. Thank you. Yes.
You're sent a form, maybe it's a couple times a year, where you're supposed to sign, if your address is the same, is your insurance the same, is your whatever the same, you just check on the bottom of the sheet if you change when you send all that in. So how is that used compared to when you call for an appointment and they ask you the insurance questions all again?
Yeah. Well, we have 2 processes. So if you're a brand new patient coming to Mayo and you've never been seen before, versus you're an established patient and you're calling. And so definitely there are certain intervals throughout the year where we want to verify that insurance and make sure that that's still accurate. So as we get information in through mail, through portal, however patients get us that information, we want to update that. So some of our future workflows may be that we would just validate that. So I see that you still have X, Y, and Z insurance, nothing's changed, because for some people, they may have just gotten a new job or something may have changed in that interval. But if you can think back to when you first made appointments, or if you had to make an appointment for someone and we had nothing on file, it's a new process. Would it be easier for you to have your information and give us all that on the phone at that point in time before we made the appointment? Would you rather have us make the appointment and then get that information afterwards? Those are some of the processes that we're trying to work through so that we can provide, get all the information we need, but also make sure there aren't any surprises as well. Yes, ma'am.
I would say that if you tell them your intention, tell me as a patient, that I have some questions, would this be a good time to verify this information? It'll take about 10 minutes and I'll need your insurance cards. Would you let them know? And then you can sit down with a cup of coffee or whatever and be prepared. But if it goes on and on and on, my mind is spinning on something else that I should be doing. Say, can I just take care of this after you get the appointment? So I think it needs to be announced ahead of time, how long it will take, what your needs are. And then if it's convenient, then that would be fine, right?
Take you and then you. So yes, ma'am.
When you get a phone call, a lot of times saying you're not home, what shows up on the telephone to call back is this number that ends in 1700.
Yeah, it's not.
You can't talk to
Yeah.
anybody, you don't know who called or anything.
Okay. Yes.
Pretend I'm a school teacher and my day is very busy. I have very little time to even go to the bathroom, much less make a long phone call
Correct.
to schedule an appointment. So for me then, or for my family situation, I need a chance to do the insurance some other time rather than the time that I'm making the appointment.
And if you made the appointment, so if I want to make sure I'm understanding you correctly, so would you rather us go ahead and make the appointment and then find a time that's convenient to verify that?
Yeah, because I have, I'm responsible for these children from 8 o'clock in the morning to 4 o'clock in the afternoon with very little time.
And
I'm
just-
just pretending, I'm just.
No, that's exactly what we want, because you've all made appointments and if you were doing this today, and we.
Can they call in the evening? Is there someone that can take the information in the evening?
Good information, because we look at extended hours. Let me ask one more question before I follow up with you. So would you prefer, and would it matter whether we had various ways to communicate with you? So if, as we have our portal, I think somebody talked about that, if you were able to enter that information, if we sent you a link, or if you would want to do that versus getting on the phone, would it be helpful to have various formats depending on what was best for you? If you wanted us to call, we call. If we do it during the phone call, we could. There might be other ways to get that information. Helpful? Thank you. Yes?
I was just gonna say though, that if the appointment is made before they have insurance, just that it's communicated that they will be checking insurance,
Mhm.
or we need the insurance before we can finalize the appointment, so that there aren't surprises. You think you have this appointment, and then all of a sudden it's like, oh, you don't have coverage here,
Correct.
and that kind of a surprise.
And that really comes down to the root cause of what we're looking at. So as patients are calling, most people want to make sure they're walking away with an appointment. And would they rather have to know that there's not going to be any financial surprises versus making the appointment and then having us contact you and then be disappointed, or if we couldn't get contacted with you, finding out when you're here that there may be some things. So those are all things that we're balancing.
A couple of other things, when you're not on Medicare, like if you're below 65 and you need, a lot of insurance companies require pre-authorization
Yep.
for certain radiology procedures and
Yes.
MRIs. And I've been in a couple of departments where the staff didn't seem to realize that, and people were scheduled for things, and then they had bitter consequences as a result of that.
Yeah.
So I just think there should be a better way of dealing with that, to make sure that that's done before the appointment is actually culminated.
Yeah.
Also with ABNs, the advance notice,
Yep.
even with that Medicare, turns out very hard to find out why sometimes. Usually it's a coding issue, but the thing is, it's very hard to actually, for a patient, to actually find out exactly what is going on with that. 'Cause I know usually when you'll get one, the computer will spit it out and you try to find out who you can talk to about it, there's nobody there.
Okay.
And that's a big issue.
Yeah, good information to take down, because I will self-disclose, that's not my area of expertise, so I don't want to give you any erroneous information, but we are cataloging things, and it's great feedback to hear, because you're absolutely right. There are certain procedures, and radiology is a high volume area where you may need some pre-certification done, so it's good feedback to hear. Yes?
I just want to add a piece, and this might not be your area either, but it does say in there related to the decision tree piece.
Yes.
I have had most of my experiences related to setting up an appointment. I have truthfully spent 40 minutes on the phone related to the decision tree process.
Okay.
And just like she said, with all of our roles of what we do in our lives,
Yes.
it's like, that is not acceptable.
That's a long time,
It's
yes.
a long time,
Yeah.
so to add that with the insurance piece, so how is it that I can do that decision tree piece before I call, or so we can, because, and I know people who have said, I'm just going to the ER because I don't have 40 minutes to have them figure out where it is and what I need to do. And that's not appropriate use of our resources.
Yeah. Your feedback is great, and I'm glad that you brought that up, because we certainly work with our physicians who give us the questions that they want to ask. So it's truly, they want to make sure they're seeing the right patient, but then our job also is to reflect how that is going to be experienced by the patient. So that is a lot of time to be able to spend.
It is, and truthfully,
Yeah.
I mean, and I work here, and I
Yeah.
don't want to use the ER, but I have.
So let me ask a
Because of
question
that.
too, with a phone being kind of a traditional way to do that. But I know one of the projects that we are working on is that Mayo is going to a new electronic medical record, which is going to give us many more robust tools to be able to do things differently, which is why we're looking and getting feedback on that. So if we were able to do some of those questions via an online mechanism for people that might choose to want to do that, that might be another option that you could do at your leisure, and then we would be able to contact you. Otherwise, we'll continue to work with our physicians on what really is relevant to
Yeah,
be
my
able to
daughter
look
is
at.
sick tonight, so I go through it at home, and
Yeah.
then it's in her portal, so in the
Yeah.
morning when I call, it's already done.
Yeah, and another
And
thing,
the 40
which is,
minutes is already taken care of.
it's great feedback, because again, one of the things we're looking at, which is a little off topic, but I'll just mention it because it's a time saver, is that as you answer some of those questions, then it's cataloged in places where we don't have to keep asking you that again, which is probably an experience that we all face sometimes too. So we want to make sure we're getting those answers and then having them. Yes, sir.
Sometimes you have to wait a very long time in certain specific departments to get even a person on the phone to talk to about the appointment. And I'm not quite sure if that can be evened out, or if there's a certain level of expectation that somebody will be answered in a certain, like within a certain time limit, but I kind of think that there should be.
We actually do. We have actually service expectations at all of our Mayo Clinic sites. So not just Rochester, but also in our Florida, Arizona campuses and some of our health systems. So
what is it?
Yeah.
What is the,
well, we actually do want to be able to not have you on the phone. Initially, we want to be able to answer those phones within seconds if we can. So what happens though is sometimes we all know we have peak time periods. So Mondays, for example, are very high volume days. And if you have staff that call out sick, sometimes you're adjusting those. So we're always looking, and we record our calls. We actually have systems where we can look in real time and see how long patients are waiting in our appointment offices. Now, some of the calls that you may make may be your physician secretary's office, and they may not be on the same systems that we are. But we definitely have service values, and we want to hold those up. So we continue to work on those.
Just for time, because we
Yeah,
have
we are.
two more, but I have
Yeah.
one more
Yes,
question,
ma'am.
so patiently, and then,
I was just gonna say, we talk about different methods of people providing information, provide a link, so they can do it on the portal or whatever. But I think it would also be helpful to, even if they said they could do it on the portal, if you sent them the written information, because then at least they know what information they have to get ready, so then, if they're,
You can choose.
well, they can choose, and then, sometimes, I can do it on the computer, and then that's when the computer has issues.
Yeah, freezes up.
You can't do it at home, but you can do it at another place, at
Yeah.
least you can get all your information ready, you can
Yeah.
do it, not just have a link, you sit down and you go, oh crap, I don't have any of the information.
Yeah.
This way you at least be prepared, if you're totally, computer totally fried and had no access, then once you have the printed forms,
Yeah.
you could get it done, rather than having to contact somebody else again to get the printed forms.
Excellent.
Good feedback.
All right. Well, On behalf of our Access colleagues across all of the Mayo Clinic, I really appreciate your feedback as we look at designing some of the new ways to get that information. Thank you for your comments.
Thank you so much for coming on.